Can we talk about the campaign objectives?
We continue to reform the campaign itself, but essentially what we're trying to do is have at least one advocate, hopefully multiple advocates or a community of advocates in each congressional district to develop relationships with their congressional elected officials. As constituents, there is an incredible power because I think I said a bit earlier, there is sort of a need to respond to their constituents because they represent, as representatives or senators, their constituents, the people that live in their districts or their state. The first goal and what we really tried to do is create conditions of empowerment within those congressional districts to uplift the work that is going on in the district, the need in the district, be those sources of expertise and wisdom for the offices and the staffers. So that way, when there is a bill or any conversation around mental health, there is a resource that the congressperson or their staff can turn to. As we continue to cultivate that, and as we move along all 435 congressional districts around the country, we are illustrating a groundswell of support broadly for sort of a different use of funding. The second phase is through those relationships. As we cultivate that, we will develop calls to action that become readily available as Congress begins to become a little bit more sophisticated in its thinking around trauma-informed care and mental health care broadly, mobilizing around those calls to action, being able to take those relationships that we develop with offices or that our advocates develop with offices and mobilize communities around supporting those calls to action to help move them more quickly and hopefully more successfully in Congress is sort of the theory of change that we have. And then that can take so many branches as we move forward through the campaign and respond and create various calls to action. One of the key things that we did at first was try to develop and broaden and expand the bipartisan House Trauma-Informed Care Caucus as a body that within Congress holds champions that can sort of promote this from within the halls of Congress, as well as supporting the advocates on the outside. And, the mental health concerns, the impacts of the pandemic outside of the immediate physical health concerns start to become more and more of a concern. We are there as a body, and hopefully we continue to grow to sort of elevate the need to meet the holistic needs of the population, individuals, families, and communities.